Bad news, people. The government shutdown, it's led to CMS, the Center for Medicare and Medicaid Services, ceasing payments for Medicare to doctors. For the care of patients.
If you're a healthcare provider and you don't already know that Medicare coverage for telehealth services expired on October 1st, 2025, because the government is on a shutdown, we don't have a contract to speak of. And I don't know what's going to happen if you're continuing to see patients via telehealth. You might not get reimbursed for the care that you're providing. How are you handling this? Because it's concerning. And the saddest thing is that our Medicare population is the most vulnerable.
No one pays attention until it happens to you. I repeat, no one pays attention until it happens to you. But I am so sick of me and my family suffering because of your freaking decisions. I go to the pharmacy. Thank you, Lord. I am not on a lot of medications. For my age, I am on only one. My hormones. And guess what? TRICARE's down. It's been down all day. They do not know what's going on. But if you have TRICARE today, October 15th, not only did you not get a paycheck because you're furloughed, but you don't get your medications paid for today. Or you can get your medications, perhaps, but you have to pay for it. Remember when I told you? Do you think the worst of it is your house and your job? They're coming after your health. And they're going to keep on blaming the Democrats when we know it is not the Democrats. Stop making us all pay for your stupid decisions because you don't want to see me without my hormones.
Republicans, they're yelling that illegal immigrants are on Obamacare. You know what, though? That's not even true. Undocumented immigrants can't legally get Obamacare or Medicaid. I mean, that's federal law. What's really going on is that in some states use their own money to cover people outside the system. And politicians, well, they twist that to score points. Now Republicans are drawing the line in the sand saying, hey, we're not giving in because Obamacare covers illegal immigrants. And, well, that sounds tough, but it's not fixing the real problem. The real issue is what's happening right now. We're in the middle of a government shutdown because Congress won't agree on extending the ACA subsidies. And if they don't, well, there's going to be millions of taxpayers that are about to lose health care that they already pay into.
As a physician, I don't believe that politics belong in healthcare. I don't want politics involved in healthcare, but I'm okay with government being involved in healthcare, especially when it comes to providing those who have less with healthcare so they can get the care that they need. I feel very strongly about this because of a personal experience I had while a medical student. I had a family that gave birth to a boy who ended up needing to be in the neonatal ICU or the NICU because he had stopped breathing. Dad was literally holding him when he turned blue, and they had to rush him to the neonatal ICU, had to stay there for a week. The family had to be discharged home with a monitor for their baby. They had to rent it for 6 months. Family had no insurance. Both of the parents had no jobs. They had no income. But luckily, because we are in the state of Michigan, that baby ended up getting approved for Medicaid. And so that family was able to get all of that care at basically no cost to them. Now you might be saying, man, that sounds whatever. I can't believe that they didn't have to pay anything for that. Well, believe it or not, that family was us. We were both medical students working really hard to become doctors, had no income. We were living off of student loans. Our son was born. I was holding him. He stopped breathing. Had to rush him to the NICU. We would have done anything, paid anything, quit our medical school, anything to save our son's life. Luckily, because we were in the state of Michigan and our son qualified for Medicaid, we didn't have to worry at all about that cost. And that allowed us then to focus on our family, focus on our son, and then later on focus on becoming physicians so that we could help hundreds and thousands of people, me as an emergency medicine doctor and my wife as a trauma surgeon. So Medicaid, Medicare, subsidized healthcare for people has a very big purpose. It helps people who need that help. And so that's why I think that I don't want politics in healthcare. I want people to be able to get the healthcare they need when they need it.
If the Affordable Care Act actually worked, then why are there so many Democrats coming online and crying that 22 million people are going to lose access to their health care? Well, you see, the Republican government shutdown is currently taking place because Republicans want to roll back Affordable Care Act subsidies. Therefore, 22 million people will be impacted by those subsidies being rolled back. Which 22 million people being impacted by these subsidies being rolled back goes to show you that the Affordable Care Act was a vital moment in American history to make healthcare more accessible to many other people.
Hello guys, and welcome to the Joy Reports, where we get an outsider's view with an insider's clarity. Across the country, panic is quietly setting in among millions of Americans who once believed a government shutdown would be a temporary inconvenience. Now, reality is hitting hard as healthcare costs skyrocket overnight, leaving countless families scrambling to figure out how they will afford routine checkups, prescription refills, or even emergency care. What makes this moment even more striking is that many of the people now facing sudden financial overwhelm are the same voters who proudly supported the very leaders responsible for the shutdown. They expected strength, they expected protection. Instead, they're getting medical bills they can't pay and insurance plans on the verge of collapse. Before we proceed, all credit goes to the creators of these videos. Let's watch a few more clips and I'll be back with more commentary.
Republican lawmakers say that Democrats have shut down the government to give free health care to illegal immigrants. That's their rallying cry anyway. But it's built on a lie that's so thin you can see the greed shining through it. The only law that remotely touches that issue is EMTALA, a Reagan-era statute from 1986. It says that hospitals that receive Medicare funds must stabilize anyone who walks into an ER in critical condition, regardless of citizenship or insurance status. It's not free healthcare, it's triage. It's a law designed to keep people from dying in the waiting room, a law that can't be changed in a budget bill. Because appropriations bills fund programs that already exist. They do not write or repeal laws. That power belongs to separate authorization legislation, which must pass both chambers through normal order. The only time Congress can alter a standing law inside a budget bill is under reconciliation, a tool created in 1974 to allow narrow budget-related adjustments to taxes and spending. But even then, the Byrd Rule prevents adding anything that doesn't directly affect the federal budget. So you can adjust subsidy amounts or spending levels, but you can't rewrite legal eligibility requirements like the ones laid out in EMTALA or the Affordable Care Act. So when Republicans say this shutdown is about Democrats wanting to fund free health care for undocumented immigrants, they're doing something far more sinister than lying about numbers. They're lying about the process itself. They're pretending a budget resolution can fix a legal issue it doesn't even touch. They're counting on the public not knowing the difference between a law and a ledger. But the truth is this. There's nothing in the One Big Beautiful Bill Act or the continuing resolution that deals with immigration or health care for undocumented people. Nothing. What those bills do contain are deep cuts and structural changes to health care programs for everyone else, ordinary Americans. The OBA phases out ACA premium subsidies. It slashes Medicaid funding and defunds key healthcare provisions under the guise of balancing the budget. And that's what this shutdown is protecting. The right to make illness profitable again.
The shutdown didn't just close parks and delay paychecks. It abruptly halted critical federal programs that keep healthcare running in the background. Subsidies were frozen, claims processing delayed, pharmaceutical negotiations paused, and just like that, insurance providers began passing those increased risks and administrative delays onto customers. The healthcare machine kept moving, but now without the stabilizers. And the people feeling the first wave of consequences are not wealthy elites or big corporations. It's everyday voters who believe they were insulated from chaos. Many of these individuals genuinely thought the fight in Washington wouldn't reach their kitchen tables. They assumed shutdowns were only political theater. But now, suddenly, pharmacists demanding cash because current systems are temporarily offline, clinics refusing to schedule appointments without upfront payments, elderly patients cancelling specialist visits because they're terrified of surprise billing, parents rationing their kids' asthma medication because refills are now out of network. People who proudly claim they were prepared for anything are now staring at medical debt before they've even stepped into a hospital. What makes this even more painful is that many of them truly believed that supporting strongman politics would bring stability. They thought it would rein in government waste and drive costs down. Instead, the shutdown has exposed just how much their daily survival depends on invisible government infrastructure they didn't realize existed. Behind every affordable prescription was a policy. Behind every managed care cost was regulation. Behind every discounted clinic visit was funding. Without those things, the entire system tilts instantly in favor of profit over people. Some are now openly expressing fear, not in protest form, but in quiet, anxious conversations with neighbors and families. They're not sure how they'll make it through the next few months. Some are contemplating dropping coverage altogether, gambling on health. Others are taking on second jobs just to keep their insurance active. Even worse, rural communities are being hit the hardest, as smaller clinics already struggling to stay afloat are closing their doors entirely due to reimbursement delays. That means some families must now drive hours just to see a basic physician. For those with chronic conditions, it's not just an inconvenience, it's life-threatening setback. And yet, the painful irony is that many of these people still don't know who to blame. Some are furious at insurance companies, others are blaming hospitals. A few still insist the media is exaggerating the problem, but deep down, there's a growing awareness that shutting down the government wasn't a harmless political strategy. It was an economic grenade tossed into the most critical part of American life, healthcare. And it's the voters, not the lawmakers, who are paying the price. Meanwhile, wealthier politicians and commentators who cheered on the shutdown aren't scrambling for refills or fighting over coverage. They're not the ones getting dropped by providers or told to pay cash for insulin. They'll never see a $5,000 emergency room bill hit their mailbox, but millions of working-class Americans will. And many of those Americans are now realizing that the people they trusted to protect them have instead put them in harm's way. This moment is exposing something deeper, the fragility of belief. It's easy to support aggressive political moves when it doesn't touch your life, but now that it has, the tone is shifting. Some are regretful, others are angry, and many more are simply scared. Scared of getting sick, scared of losing their homes to medical debt, scared that the system they thought they understood is far more complicated and far less stable than they imagined. The coming months will reveal just how far this crisis spreads. Will hospitals begin turning people away? Will uninsured rates spike again? Will preventable illnesses rise because people are too afraid to seek treatment? One thing is certain. The shutdown wasn't just a political stunt. It was a direct attack on healthcare stability. And the people who once shouted the loudest in support are now whispering quietly in panic, because when politics becomes more important than people, it's always the people who suffer first. So what do you all think? How long will they tolerate this before demanding better? And how many more families have to choose between medicine and rent before accountability finally kicks in? Let me know your thoughts down in the comment section. I would love to keep this discussion going. Otherwise, that's it from me. I also have another video specifically tailored for you. And if you enjoy such kind of content, please click up here and enjoy. Also, consider subscribing, liking and sharing because it helps me grow my channel and helps YouTube recommend this video to a wider audience. But for now, thank you so much for watching. Until the next time, the Joy Report out.